I think we might have some technical issue encountered here with Dr. Shang Yu. Right? So maybe we can proceed with the next question, and when he's back, I think we can have him answer that again. Will that be good, Wahayo?
Sure.
You still have another question to another guest in China?
Yeah, can I jump to the question?
Yes.
Hello. Yeah. Thank you for the opportunity. Yes. I'm Dr. Brian. Now I'm working to support the Executive Office of the President and also backing up a national task force for COVID-19 in Indonesia. So my question actually is related with the case fatality rate. So we read clearly in the report and the publication that stated that the case fatality rate in Wuhan is around 1 to 3%. But if we see the figure in Indonesia, following the data in Indonesia, we have sometimes the CFR is around 10%. And today, if we really see the data like mentioned by our host in the beginning, that in Indonesia, currently our CFR is around 7.5%. And see again in global, also almost the same, it's around 7%. So I have actually in Indonesia, the rationale to explain the situation is the fact that Indonesia now still facing the limited number of laboratorium. And then also, even though in the beginning it's very, very limited number, but now it's already decentralized into around 48 laboratorium. But also we have another problem, like, for example, the stock out of the reagent, the VTM, and etc., etc. But see that again, consider that the CFR Indonesia and the global is almost the same, around 7%, while in Wuhan, based on the report, is 1 to 3%. So my basic question actually is whether now are we now facing the same virus between what happened in Wuhan and also what is happening now in Indonesia and global. And assuming the virus is the same, so even though in the beginning we discussed a lot about the treatment and then the case management, but maybe a colleague in China can give us the the top key point that may be missing from our Indonesian attention. So again, this is about the case management. I have another question actually, but I will raise this if the time still allows. Thank you very much.
Let me answer your question. Let me answer your question. I think it's because we have adopted several different public health measures. First, I believe that in Wuhan, in the early stage of the outbreak, we have adopted very strict quarantine measures, and we have shut down the city, asked everybody to stay at home to avoid any further infection. Second, we have done quite vast testings. Basically, you mentioned that PCR testing is covering about 20% to 30% of all the patients, but actually we are using 100% PCR testing. We have a large number of the PCR testing ratio, and we have that is why compared with the PCR testing number, the fatality ratio is relatively small. The third part is what I want to talk about is we have adopted the makeshift hospital, the temporary hospital in Wuhan. At the early stage of the outbreak in Wuhan, the fatality ratio is around 5 to 6%. I think it's quite high. But later on, we have actually collected all the mild patients into the temporary hospitals to ensure that they have enough rest and they don't need to worry anymore about the medical treatment. And I think it's actually eased them up. And if they are turned into the severe cases, we can send them into the designated hospital in a timely manner. And because this disease is a virus-triggered disease, so it is self-limiting. Many of the mild patients actually recovered in the makeshift hospital. And in the makeshift hospital, we have also guaranteed adequate medical resources. With a very good condition in the makeshift hospital, the patient is going to improve their immunity, and it is greatly reduced the mild to severe ratio for the whole population. So I think makeshift hospital is a very good public health measures to treat the mild cases patient. And I also think that you have other different choices, and I believe other different countries has offered you quite different choices and options. For example, as I heard, in Germany, they have these public health hospital buses to conduct follow-up effort. That is to say, if the patient caught the disease in their own home, they can call the hospital bus to be taken care of. So at any time, so the general public is quite assured that all the medical resources is going to be delivered at their doors. So this has greatly reduced the ratio for the mild cases to slip into the critical and severe cases. That is all of our public health experience. Thank you.